Morning, everyone. That is, I welcome everyone for the webinar on career transition guidance. So let us see the quote on this. The thing always happens that you really believe in, and the belief in a thing makes it happen. So this is a really wonderful quotation that the thing always happens that you really believe. Whatever we believe, that will be come true, and the belief in a thing makes it happen. So what we can believe that can be happen. So I welcome once again everyone for this wonderful webinar on the title Strengthening International Career Pathways in Nursing Profession. This is Professor Dr. Usharani Kandula, Department of Nursing from the Herbal. Let us see that the strengthening international career pathways in nursing profession. So what do you mean by this? Strengthening international career pathways in nursing profession, which refers to improving opportunities, systems, and support structure that allows nurses to work, train, and advance their career across different countries. And coming to here, this concept is increasingly important due to global nursing shortages, aging population, and the need for skilled healthcare professionals worldwide. So coming to this, so what is harmonizing education qualification? So what do you mean by this harmonizing education and qualification? One major barrier to international mobility is differences in nursing education system. So just we have to be harmonized, equalize everywhere. So what is the strategies? Standardizing nursing curriculum across countries, aligning qualifications with the global framework as like WHO standards and ICN standards. Another one, simplifying licensing and credential recognition. So wherever we complete our profession, so when we move to the other countries, we have to register there to equalize our license. And many nurses face complex registration and licensing procedures when migrating. So these strategies streamline credential evaluation process. The credential process will be evaluation process should be easy, and bilateral agreement from nursing and licensing recognition and digital credential verification platform. So in through the online platforms, we able to do this process very easily. Then other one, ethical international recruitment. So the whenever we get to recruitment, it should be legally should be there, and the recruitment should avoid harming healthcare system in lower income countries. And what are the guidelines we must follow here? WHO Global Code of Practice on international recruitment of health personnel and transparent contacts and fair employment conditions and protection against exploitation and discrimination. And coming to this, the fourth one, the language and cultural competency support. So the major burden for everybody is language barrier. And a nurse is moving abroad often face language barrier and cultural adjustment challenges. So how to overcome this? And it can be overcome through support programs like language training, IELTS, IELTS and OET preparation, and cultural orientation program, how to behave there, how to talk to other country people, and mentorship and integration programs in hospitals. Through mentorship, we can able to collaborate with other hospitals to have a knowledge on this environment. And then coming to career development and specialization opportunities, international pathways should also focus on long-term professional growth For example, international fellowships, advanced practice nursing programs, and global research collaborations, and leadership and management training. The another one, government and institutional partnership. Strong pathways require cooperation between governments, nursing councils, universities, healthcare organizations, and international bodies like WHO and ICN. And coming to digital platforms and global workforce networks, technology is increasingly used to support international mobility. For example, online credential verification system, global job platforms for nurses, and telehealth training programs. And the another one, supporting migrant nurses' well-being. Policies must ensure migrant nurses receive fair wages, safe working conditions, access to mental health support, opportunities for family and reunification. And coming to this, another subtopic is global opportunities, qualifications, and requirements. So, what do you mean by global opportunities in nursing profession? The nursing profession offers extensive international career opportunities due to a global shortage of healthcare workers. So, many developed countries actively recruit nurses from overseas to support their healthcare system. So, so what are the major countries we can able to migrate? Some of the most popular destinations for international nurses include the United States, UK, Canada, Australia, Ireland, Germany, New Zealand, Norway, and Switzerland, United Arab Emirates. So not only this, there are so many countries giving opportunities to extend our progress, and these countries provide attractive benefits as like competitive salaries, career development opportunities, relocation support, and pathways to permanent residency. Sometimes even we can have the permanent residency to relocate that area. And so, what are the areas of employment? International nurses can work in various healthcare settings like hospitals and clinics, long term care facilities, community health centers, rehabilitation centers, and mental health institutions, home healthcare services. Not only this, moreover, they can work in the specialized roles as like ICU nurses, emergency nurses, and pediatric nurses and mental health nurses are particularly high in demand in the worldwide. So, what the nurses can do? What is a required education qualification? Education qualification for international nursing careers, which include to pursue nursing opportunities abroad. Certain education requirement must be met. So, what are the basic academic requirements? Most countries require Bachelor of Science in Nursing or equivalent degree, completion of an accredited nursing program, and clinical training during the education. And professional registration. After completing education, nurses must register with the national nursing regulatory body in the country where they intended to work. Then, so it is the regulatory bodies, and each area, each country having their own regulatory body. For example, the India having the regulatory body is INC, and the same like other countries having their own regulatory bodies. Like when coming to the United Kingdom, Nursing and Midwifery Council, and United States State Board of Nursing, Canada, and Providence College of Nurses, Australia, Australian Health Practitioner Regulatory Agents, and Ireland, Nursing and Midwifery Board of Ireland. And coming to the key requirements for working as an international nurse. So, although requirements vary between countries and several common criteria must be usually met, the other one is the licensing examination. Most countries require internationally educated nurses to pass their professional exams. What are the professional exams? For example, NCLEX are in United States and sometimes Australia. And then CBT, OSCE, United Kingdom, and Competency Assessment Canada, and AHPRA Assessment Australia. And these examinations evaluate clinical knowledge, in patient care skills, and professional competency. And another one is the language proficiency. Communication is essential in healthcare. So nurses must demonstrate proficiency in the local language. Common language tests include like IELTS, International English Language Testing System, OET, Occupational English Language Test, and then CELPIP Canada. And some countries also require knowledge of the local language. For example, German language proficiency for the nursing jobs in the Germany. And then work experience. Many healthcare employees prefer nurses with 1 to 2 years of clinical experience, experience in specialized fields as like ICU, emergency care, or pediatrics. This ensures that nurses can adapt quickly to international healthcare systems. And then credential verification. Education and professional qualification must often be verified by international credential organizations. For example, CGFNS, Commission on Graduates of Foreign Nursing Schools, evaluates credentials for nursing nurses seeking employment in the United States. And coming to this work visa and immigration requirements, international nurses must obtain legal authorization to work abroad. Common visa pathways include that skilled worker visas and employers sponsored work permits. Then permanent residency pathways for healthcare workers. Many countries allow nurses to bring family members and eventually apply for permanent residency. And the benefits of international nursing career pathways. What are the benefits we can gain? And then strengthening international career pathways benefits both the nurses and healthcare systems. So other benefits like higher salaries and better working conditions, access to advanced training and specialization, exposure to diverse healthcare systems, and opportunities for global networking. So benefits of healthcare system: address nursing shortages, improve patient care quality, promote knowledge exchange and skills transfer. The global shortage of nurses is expected to continue, increasing international career opportunities for qualified professionals. And then so let us conclude this, and strengthening international career pathways in the nursing profession is essential for addressing global healthcare workforce shortages and promoting professional mobility. By improving qualification recognition, simplifying license procedures, and supporting international recruitment, nurses can access reward opportunities worldwide. And then coming to this, meeting education requirements, passing licensing examination, demonstrating language proficiency, and securing work visas are key steps in pursuing an international nursing career. So nothing is impossible. The word itself says that it is possible. Thank you. I hope that you understood the concept of this. Have a nice time. Thank you.